Types of mechanical ventilation / classification of mechanical ventilator: negative pressure ventilator, positive pressure ventilators, pressure cycled ventilators, time cycle ventilators, flow cycled ventilation. Negative pressure ventilation, Lewis. It involves the use of chambers that encase the chest or body and surround it with intermittent subatmospheric, or negative, pressure. The iron lung was the first form of negative pressure ventilation, developed during the polio epidemic. Intermittent negative pressure around the chest wall causes the chest to be pulled outward, reducing intrathoracic pressure. Air rushes in through the upper airway, which is outside the sealed chamber. Expiration is passive. The machine cycles of, allowing chest retraction. This type of ventilation is similar to normal ventilation in that decreased intrathoracic pressure as produce inspiration, and expiration is passive. Negative pressure ventilation is delivered by non-invasive ventilation and does not require an artificial airway. Several portable negative pressure ventilators are available for home use for patients with neuromuscular diseases, central nervous system disorders, diseases and injuries of the spinal cord, and severe chronic obstructive pulmonary disorder. ICU book: Negative pressure ventilators are not routinely used for acutely ill patient. Negative pressure device mimics the action of the human diaphragm and respiratory muscles of the chest. They apply external negative pressure on the chest wall, causing the rib cage to expand, decreasing intrathoracic pressure and allowing air to be drawn into the lungs. Inspiration occurs when the subatmospheric pressure is created around the chest and abdomen of the patient. This type of ventilation requires the patient's upper torso and trunk to be completely enclosed by the device. Passive exhalation occurs when the negative pressure ceases. Patient have restricted motion which leads to musculoskeletal, back and chest pains. These devices can be used for chronic ventilatory assistance, particularly in those patients who are unresponsive to conventional mode of therapy. Such patients can be ventilated without the endotracheal tube or tracheostomy, resulting in decreased mechanical work of breathing and with improved gas exchange. Negative pressure body ventilation is used primarily to assist patient during slowly progressive neuromuscular diseases such as muscular dystrophies. They are also being used increasingly for other groups of patients, such as those with chronic restrictive lung disease from kyphoscoliosis, who need only intermittent periods of assisted ventilation, and those with high spinal cord injury, ARDS, and pneumonia. Positive pressure ventilation, Lewis. Positive pressure ventilation, PPV, is the primary method used with acutely ill patients. During inspiration, the ventilator pushes air into the lungs under positive pressure. Unlike spontaneous ventilation, intrathoracic pressure is raised during lung inflation rather than lowered. Volume ventilation: with volume ventilation, a predetermined tidal volume, VT, is delivered with each inspiration, and amount of pressure needed to deliver the breath varies based on the compliance and resistance factors of the patient ventilator system. Consequently, the volume ventilation /VT is consistent from breath to breath, but airway pressure varies. Pressure ventilation: with pressure ventilation, the peak inspiratory pressure is predetermined, and the VT delivered to the patient varies based on the selected pressure and compliance and resistance factors of the patient ventilator system. With this understanding, careful attention must be given to the VT to prevent an unplanned hyperventilation or hypoventilation. For example, when the patient breathes out of synchrony with the ventilator, the pressure limit may be reached quickly, and the volume of gas delivered may be small. Initially, pressure ventilation was used only in stable patient being weaned from the ventilator. Today, pressure ventilation is frequently used to treat critically ill patients. This inflates the lungs by exerting the pressure on the airways, forcing the alveoli to expand during inspiration. Expiration occurs passively, which further includes time-cycled ventilators, pressure cycle ventilators, and volume cycle ventilators. Pressure cycle ventilation terminates inspiratory phase at a preset PIP-TV, tidal volume, varies directly with lung compliance and inversely with airway resistance. Advantages: reduced barotrauma, which has been implicated secondary to high PIP, important to monitor patients' expired tidal volume. ICU book. Positive pressure ventilators work on the opposite principle from negative pressure devices. They create a positive, greater than atmospheric pressure at the upper airways, example, tracheostomy or endotracheal tube, and thus force air into the lungs. Expiration occurs when the positive pressure is removed because of the elastic recoil properties of the lungs and chest wall. Positive pressure ventilators allow for greater access to the patient and the patient's airway flow. Cycled ventilation terminates the inspiratory phase when inspiratory flow reaches a predetermined minimal level measured during spontaneous ventilation, mostly seen in pressure support modes of ventilation. Time cycled ventilation terminates the inspiratory phase when a preset inspiratory time has been reached. Advantages: ease to regulate inspiratory and expiratory ratio, especially when inverse ratio ventilation is desired. Disadvantages: delivered tidal volume is dependent on airway resistance and compliance characteristics.